Welcome to Hemp Sister Nation, where you don't need a reservation. I said, Mama, the Lord stand with open arms. He'll warn you with a one more time. Yeah, one more time, baby. Welcome to the nation. I said, welcome to the nation.
Hello, you beautiful people. Lolo Carter here of the Hemp Sisters of the Hemp Sisters Nation, appearing solo on the Hempy Hour. It's a little side gig edition here. So, okay, where does one begin? I wanted to stop in, say a little something. Look, if you know me, you know what I want you to know about me. You dig? Aren't we all like that? I'm very social, outgoing, but when it comes to things that are going on in my life, I'm just one of those that, I don't ever want the conversation like, oh, did you hear what happened to Lois? Like, just, it's not my thing. It almost mortifies me to a point. However, as I'm getting older, I'm realizing that, while it's beautiful that I have very close people in my life to share things I don't share, there are some opportunities here to talk to people that I know as professionally or otherwise about other things going on, that might travel and trickle and might hit somebody's ear. And for a person that's always talking about sharing experiences and connecting with others, I'm quite quiet about a lot of things that are kind of important, So today we're going to be talking about a word that I just learned in March at 46 years old. And the word is Apical Hypertrophic Cardiomyopathy. Now, I'm still learning a lot about its definition and what it actually means in my life. However, I'd like to share to you a little story about a girl who doesn't go to the doctor very rarely. And as I explained, we'll really just kind of hold things internally for as long as possible, to not appear, I don't know, weak or needy. I don't know. I'm growing. That's all I gotta say. Anyway, so sometime in December, I was actually just doing like normal stuff around the house. I was cooking dinner, and the phone, I kept getting like, it was just message after message after message, and it was beeping, and it was beeping, and it was beeping, and I don't know, something happened. It just out of nowhere, I just started to have like a really, really fast heartbeat. And to a point where it took me out, like, like I bent over and I was trying to catch my breath, and the pain that was in my chest was it was terrifying. I think when that started, I thought to myself, like, this has got to be what a heart attack feels like, like the tightness in my chest, the pain in my left shoulder to my neck. It knocked me out, I passed out, but the pain was really intense. So I made myself, and I had shortness of breath, and it was just really, really hard. So I came up and I laid down, and I was just trying to get my thoughts together. Not calling 911, obviously, but anyway, time passed by, and I, had regained like regular heart rhythm, and the pain was subsiding, and that was in mid-December before Christmas. What ended up happening in the next few months was that it just didn't stop. I would have intense chest pain most every night. Sometimes it would linger during the day, especially if I was doing something, that would cause my heart rate to, exercising, whatever it might be. It was just, anytime I did that, I just felt immediately this tension and this pressure in my chest. I would lay down at night. I could not get comfortable. I would have, again, this is pain on the left side of my body. So I'm almost embarrassed to admit, but that went on until March, to where, I had thought, okay, well, I didn't think, like, I already knew something was wrong, but, I just didn't want to deal with it like that. I just thought like it would pass, but it didn't pass. And it got worse progressively until to the part where it started like affecting my mood. I just was kind of quietly, like, I don't quietly like living in fear about this. So I called the GI doctor and thought, oh, well, you know what, maybe I was trying to like tie it in, like, oh, is it after I drink this? Or is it after I eat this? Or like, what is causing this pain? So I went to the GI doctor and they did the endoscopy, you know, but that yielded nothing. Like everything was fine, normal. So the next step would be the cardiologist. So I went probably a couple weeks after the endoscopy. Went and met him, real nice guy. It was my first cardiovascular visit ever, because till this, situation, I never had a reason to go to a specialist like that. I have near perfect cholesterol. I don't have hypertension. I had, I guess it would be normal blood pressure. There's nothing really cluing in, and no symptoms. Like every time, they looked at my heart, no murmurs, no nothing, that would flag it to be something of concern. So when I went, he was doing his little intake, right? And in our conversation, I think he just expected nothing to be wrong. Like, it sounded kind of like a panic attack, kind of like in that realm. He nearly said, like, we're gonna do the EKG, but I don't expect anything to come out of this. Throw me on the machine. Then he comes back a few minutes later and he's like, oh, I was wrong. So what did that mean? And again, like, you're part of my ignorance because I'm still kind of learning. I mean, this is the most important organ pretty much in our body next to our brains, and I just know nothing about it. So basically the EKG had stated that I had a left ventricle abnormality. This was by showing deep T waves, deep negative T waves, and left ventricle, basically, abnormality. So that pushed me into another slew of testing. And at this point, the immediate response was to put me on beta blocker. So left ventricle. My blood pressure is good. So we were focusing in on my heart rate. And they put me on a beta blocker to help lower my production of adrenaline, basically, while everything kind of gets looked at. So I got scheduled immediately for an echocardiogram and then a PET scan as well. Went in for the echocardiogram within like that month, just being on the beta blockers, like a low dose of it. And the echocardiogram basically stated that I had apical hypertrophic cardiomyopathy. And I also had a apical pouch, and I'll get into that too. Two different issues though. I don't do anything half-assed. So basically, with apical hypertrophic cardiomyopathy is a form of HCM, hypertrophic cardiomyopathy. Apical means it affects the apex of the heart, and the apex of the heart is at the bottom. It's the part that's closest to your chest, like your diaphragm. So when you're feeling your heartbeat from your chest, that's what you're feeling in the apex part of your heart, right? So the disease I have is a genetic disorder, and it's also known as Yamaguchi Syndrome. And it's specific to the apex, or the apical part of the heart. So basically, more than half of patients that have apical hypertrophic cardiomyopathy, they don't have symptoms. So this is why most people aren't diagnosed with this until later in life. I think the mean age, the mean is about 42 years old, 46 now. But the most common presenting symptom is chest pain, and chest pain can mean a lot of things. But palpitations and other things can also manifest, and that's, I think, what kind of continued to happen with me. I was just this strong chest pain, always feeling, in a very prominent feeling of a heartbeat that just kind of, then further caused anxiety because you don't know what's happening here. So biggest concerns with this type of hypertrophic cardiomyopathy is atrial fibrillation and ventricle fibrillation. So this is where the heartbeat or the ventricle goes into a rhythm, usually at a higher rhythm, and it's unable to get itself sturdy again. In apical hypertrophic cardiomyopathy and like other cardiomyopathies, the biggest risk is sudden cardiac death. Radiologically, my heart, after I had my echocardiogram, this is determined by a couple things, but mostly by the shape or the configuration of the left ventricle. So it's more of like, well, they call it like an ace of spades. So it's got a spade-like configuration. And that's its classic presentation. So the apex, again, the heart, instead of it being rounded at the end, it turns into more of a spade shape. And this is when it's compared to other variants of like HCM, the outcome of apical hypocardiomyopathy is relatively benign. Overall mortality of HCM is around 10% for cardiovascular mortality. And 1.9% after follow-up for 13 to 22 years or so. That my heart is functioning fine. I have my ejection fraction, that's the amount of blood coming in and out, is normal. I don't have a problem there. I'm also not obstructive. There are two kinds of cardiomyopathy. One is obstructive and one is non-obstructive. I am non-obstructive, so my blood is flowing through the ventricles and into the arteries as it should be. There are people that have HCM and they have obstructive. This means that the valves are obstructed by the muscle, which causes, when they get their heart racing or in heartbeat elevated, it causes that area to obstruct the blood flow. People that have that, they tend to have fainting episodes and other symptomology that I don't have, and I'm grateful for as well. However, having this disease, basically they're looking for minimizing sudden cardiac death. So that means, does this heart have the ability to correct itself if there's a fibrillation? Is the muscle too thick, meaning that it's interfering with the electrical operations of the heart? And that's kind of what's been happening to me over the last, again, so since March. So the echocardiogram showed I had this particular disease, and it also showed that I had what they call an apical pouch. So also in the area where I have the hypertrophic cardiomyopathy, it's a certain part of but 1/3 of the apex is where my disease is shown to have a genetic change in my heart. Also there, though, is a pouch. So besides that change, there's also a ballooning that has happened. Basically a spot where the heart popped out in thin area. So it's created basically an aneurysm. And I always thought aneurysm was like the event, but it's actually that's what that's called. So a clot. A clot would be the second part of that. So I'm on medication right now, blood thinners, and I'll be on those for life to hopefully avoid a clot forming in that area. Because while I do have normal ejection fraction, blood can pool there because it is not, it's in a different shape. So if that pools and, non-moving blood does what? It clots. And this is what would create an event if I didn't have the blood thinners to clot, then entering the bloodstream at some point, then causing a stroke, of course, which is actually more scary to me than the sudden cardiac death risk. Like a lot scarier. But I don't want to do this disease injustice, but there is something unique to the apical hypertrophic cardiomyopathy, is that there's not a lot of information about it. This particular variant was discovered in like 1976, so a year before I was born, and it only represents about 3% of Caucasian Caucasian HCM cases. It is more prominent in Asia, where like 35 or 40% of the HCM cases are in fact apical. So in the United States, I don't have a lot of research on this particular variant, and it is different. Not the same symptomology of other people that are facing other types of HCM. So it's really hard to find support, like personal support, because everybody that I'm in groups with, they're just in such a different place in their health. They're having continued surgeries and they have other options. I don't have those kind of options. What's been happening with me is after this was all diagnosed, I went in for basically what happened was, as I mentioned, I was put on a beta blocker. And I was doing like really good for the first couple of weeks. I have not been on medicine in my life ever. I've never taken medicine outside of, the once in a while antibiotic or whatever it might be. I've never been on any kind of medicine. So about 2 weeks, 3 weeks after I started taking it, I was feeling good. I started to feel better right away. But third weekend, my symptoms returned and I got really, really scared. I went about 4 days after the symptoms returned and I said, you know what, no, I'm going to go to the urgent care and just get checked out. Well, while I was there, they put me on the EKG machine and then rushed me to the hospital. Got to the hospital because they had assumed I was I was having a heart attack. That was not the case, though. It's just that's how messed up my EKG readings are normally, that if you're not trained with that, you're just going to think people are having heart attacks. But when I was there, they gave me a heart catheterization because, even though my echo was good, they wanted to do what they call like the gold standard of testing. So I had a heart catheterization. They go in through the brachial and go right into the heart to look for blockages and other types of arterial problems. But as I mentioned earlier, I don't have a cholesterol problem, and my arteries were nearly plaque-free. I had no clots, no stents were needed. Again, other than this constant and chronic chest pain, there was nothing really cluing as to why it was happening like that. So past that, and they put me on a new medicine. So they changed my blood pressure medication, the beta blocker for the adrenaline. And then they put me on another pain pill for angina. Now from a person that's never taken medicine their whole life, and now I have 3 prescriptions. So I'm on a blood thinner, and I'm on the beta blocker, and it's a low dose, thank God. It's, at the beginning of it, so I'm not anywhere where it's like maxed out. And then I'm on this other drug called Ranzolene, and this is for angina symptoms. So the doctor that was there explained it to me basically like, you don't have anything that in your main arteries, your large arteries, all of these are clear and there's no reason for that to be a source of pain. I thought maybe it was microvascular, that constant angina. So, but I'll tell you what, I was there for 2 or 3 days, and that day, since that day, and I started taking that particular pill, I've had little to no chest pain, comparatively. So I feel like right now I'm being managed okay. Now, with all that being said, I did have to have an MRI, and that was to really just kind of look at the thickness of the wall, because again, we're looking for things that would put me at a higher risk for sudden cardiac death. So the treatment for that is an ICD. An ICD is an implantable cardio defibrillator. This is a device that is implanted, underneath the collarbone here this way, and it's got either one or two lead wires that go into the left ventricle, and it's basically, like when you see an external one, like the paddles, but that on the inside of your chest. So if the heart goes into atrial fibrillation, or if there's any type of situation that causes the heart to stop, you are just shocked, until your heart joins into a rhythm, or not, but most cases does. But I had a really big problem with this, because as I'm getting these test results back, everything is leaning towards me not having having a very mild symptomology right now for this disease. So things I was looking at were the structure of my heart and waiting for test results, about the thickness of the heart. If the thickness of the apex was over 30 millimeters, it's like an automatic, you have to have the defibrillator. Like if the heart goes out, there's now a lot of confidence that you electrically could get your heart going again. Naturally, you couldn't get out of defibrillation or fibrillation naturally. Simultaneously, I was wearing a heart monitor for a month. The heart monitor was checking me for atrial fibrillation, or tachycardia. And tachycardia is, elevated heart rate, and the atrial fibrillation is obviously the fibrillation that throws the heart out of rhythm. So any of these three things, if I had any of those things happen on the monitor, or if my muscle wall was like over 30 millimeters, it was a guaranteed ICD. Now, I did not have any of those things over the 30 days, and I did not have my thickness of my heart is around 15 to 17 in the affected areas, normal everywhere else. So that to me was great news, because one, I don't want the implantable cardio defibrillator, and two, all the things that would have triggered me to having that did not exist. So feeling really good about that. And then I went to the doctor and he told me that he wants me to have the implantable cardio defibrillator. And he based it on a portion of the MRI that stated during the MRI, there were some diffuse spots around the heart in that area that were dephased. This meant that there was either scar tissue or some damage in these particular areas. And he felt with the condition and all these things that, that put me at a higher risk. I have a really hard head, and I don't want this device to begin with at this time. I think once I learned about this disease and what was going on, I felt like I knew that the ICD was going to be in my life eventually. It wasn't really a matter of like, is it going to? It was more like, when is it going to? And I'm not ready for that at all. And I'm also just wanting some backup, because I'm looking at it from the perspective of, I've got this problem, and this is about where it's going to be, right? It doesn't necessarily get worse or better. And I thought, do I really want to start putting things into my heart that is functioning properly right now? And my symptomology is seeming to be under control. And I've just March, April, May, June, July, 4 months into taking medication, like, why would I jump right into surgery on my heart, right? So for now, I'm not doing that because I have other things in the works. But I guess why mostly I wanted to do this is there's a couple of reasons. Is that, I'm learning about something new, and learning a lot really fast. But I'm also, it's very lonely with this because there's just nobody that has this. I don't know, even the groups I'm in, there's just nobody that has this particular presentation. Like they don't have this form of it. And I'm really wanting to learn more about it. But like I said, like I go online and there's just nothing about it. It's really frustrating for me. And there's one electrophysiologist in my network for doctors. It's just a specialty of medicine that, it's a cardiologist, but it's a special medicine, that specialty of medicine that I just don't have access to like a center. I don't have an access to a center of excellence for care. And I don't have, I really am just looking to understand more, about this disease. Like, I don't even know if there's, what would a second opinion look like? Is it worth going down that road? I want to talk to people that have this and know what their life is like 10 years after they got diagnosed and what they do and what they learn. So this is kind of like a education. It's kind of like a, hey, anybody out there moment, I really do. I have questions, and I feel like sometimes it's really hard with providers, to. I always feel like I'm always cautious of like an ego being present, and I'm always cautious of not saying certain things when I'm seeing a provider because I'm really not trying to like have a dick fight about what do you know, and I'm trying to learn and try to make a better decision, and I do that because I feel confident understanding things as they present to me, and I try to make sense of that. So I have a hard time with a lot of providers because while I'm not pushy, I have a lot of questions, and I think people are just so used to, in the age of the internet, like having that, a lot of people are having those. They can just get annoyed with their patients sometimes. Like, why did I bother going to medical school if you're going to sit here? But I'm not really saying anything. I'm digging for questions and answers, and I don't know. It's like slightly weird vibes. Like for instance, I told him that I didn't want to do, that right away. And he says it's a really easy procedure. It's, you're in and out. We do in the state of Wisconsin, we do the most of these procedures, but there's other things I could be doing right now, being that I'm like in the infancy of my diagnosis and that I had no events during that monitoring time. And my heart muscle while thick is not even 50% of what they would do naturally for somebody. There's other monitoring options, that I can have done. As far as I understand, I could have an event monitor implanted, and that would go for like a year. And I think that's a smart decision to see if my condition changes, etc. Anywho, I'm just looking for someone to shoot that shit with back and forth. That is actually living in that moment. So if you're there, message me, please, on the page here, YouTube, or on my LinkedIn or my Facebook. And any other information that you have as far as like anything, resources, anything, whole no subject. Now, this particular diagnosis, as if I wasn't doing enough shit, this diagnosis came about 8 months after I had decided to do something very major with my body, in my health. So talk about that another time, but because it's just getting back on track from the detour that I had to be on, because of this particular situation. But anyway, well, this has been a Sesame Street special on apical hypertrophic cardiomyopathy, and a reach out. So thanks for listening. I kind of want to keep you guys updated as I go along with this and as I work with my trying to figure out what the hell to do with this heart of mine. But yeah, please, if you know anybody that has HCM or in this particular presentation of it, I would love to connect up with them. So thank you so much for your time. And the other situation I'm dealing with is kind of going to be a more of a vlogging journey. I've got a lot going on, and I really think, just really think it'd be a really good learning experience. I know that while I'm going through this, again, looking for resources and things, it's just I'm not getting the answers that I want, or not being able to like touch in on the experiences that I kind of want to touch in on. So that's coming soon. But till then, thank you again. And I think I'll see you guys. Oh, next week we have a Hempy Hour coming up next Saturday, the 22nd. So see you in 5 days.